Welcome to Open Book, a show designed to give the public information about issues in education. My name is Margie Bulkin, Tuolumne County Superintendent of Schools, and today's topic is about immunization. And with me today I have three special guests, and I would like to introduce them to you. First, I have Juliana Feriani, County Board Member. Second is Martha Stolp, our County Schools Nurse. And third is Dr. Liza Ortiz, our Public Health Officer. I'd like to start with giving them an opportunity to tell you a little bit about themselves. Dr. Ortiz.
So I have been the County Health Officer since April, and in the Public Health Department we promote vaccination and ensure that vaccine rates are sufficient to control disease.
Well, welcome to our county. I know you've really made a name for yourself and done a great job so far in our county. Welcome to the show.
Thanks.
Martha.
Yes, I'm Martha Stolp. I'm one of the county school nurses. As you know, there's 2 county nurses in our county. I take care of students with usually chronic health issues, diabetes, asthma, anaphylactic episodes. So I train the staff and help with figuring out what needs to be done for the student in the setting of the schoolroom. And my colleague Joyce McMahon takes care of students with special education needs.
Excellent. Thank you, Martha, for being a part of the show today. Juliana.
I'm a county board member, trustee area number 3. I've been on the county board for 16 years, and I've also been on the Immunized Tuolumne County Committee for the last 2 years.
Excellent. Thank you for being a part of the show. So in June, I understand that the governor signed a bill, Senate Bill 277, that has made certain specific and significant changes to the immunization law. Dr. Ortiz, could you tell us a little bit about those changes and how it impacts education?
Absolutely. So prior to the passing of this bill, parents in the state of California were able to sign what was called a personal belief exemption. Essentially, they would say that due to some personal beliefs, they chose not to vaccinate their child, and the otherwise required vaccinations were not a requirement for their entry into school. Because that makes some people more vulnerable to diseases and can increase outbreaks, and we saw a significant outbreak that happened this past winter in Southern California and, with measles. The state legislature passed SB 277, which now eliminates the ability for parents to choose to not vaccinate their child by personal belief exemption. So the previously required vaccines will now apply to all children who are entering kindergarten or 7th grade this coming fall.
So previously, parents could ask for a waiver based on personal belief, and that was generally accepted. Mm-hmm. And now everyone must be immunized. Are there any exemptions under this law? Because it sounds like everyone must be immunized in order to enroll in school, but are there any exemptions whatsoever?
The permanent medical exemption, it still is available to children who, for medical reasons, cannot receive vaccines or specific vaccines.
So describe that. Give me an example of what that would look like for a child. What would be a medical exemption that would be acceptable under that exemption, as an example?
Some children who have severe immunocompromising diseases may be put in danger if they receive specific vaccines. Right. Generally, they can still receive some vaccines.
Right. I see. So while there is a medical exemption, that has to be given by a doctor, has to provide that to the parent, who has to provide that to the school.
Correct.
In order to be exempt from this law.
Yes.
Otherwise, everyone entering kindergarten, you said, and 7th grade.
Yes.
Must show a record of immunization. Martha, did you want to add
Well,
something?
I was just going to add that the medical exemption, it would need to be, it's not a form anymore like the personal beliefs exemptions. It's now it will be a note written by a physician, not a nurse practitioner or a physician's assistant. It has to be a medical doctor or a doctor or osteopath. Okay. And they will know what they need to put in this document for the school to get a medical exemption.
Very good. Well, I've heard, related to this, I've heard this term herd immunity. Mm-hmm. And I hadn't heard that term until, first time I heard it was last year. And because I am fully immunized, and so are my children, and my grandchildren. But Juliana, what's the definition of herd immunity? What does that mean?
Well, herd
immunity.
Herd immunity means that a high number of people need to be immunized to protect against diseases. And that percentage varies based on the disease. But for measles, it's 92%. Of people have to be immunized so that those who cannot be immunized are protected from a disease.
Right.
So you're speaking about in a community of a county or school or someplace like that. The herd community would be the ones that are immunized, protecting the students that are not able to be immunized
Right.
for medical exemption.
Right, I was going to say, and there's a reason that would be applicable to protect the safety of certain children
Right.
who have a medical purpose or reason.
Or unable to be
Unable,
Right.
right. Interesting, very interesting. So historically then, what are the statistics in our county for, let's say, personal belief exemption, or in other words, those that have not been immunized? I mean, is Tuolumne County along with the national average? Are we higher than the national average? Or Dr. Ortiz, do you have a...
So we have a lot of state data. The last year for children entering kindergarten, the state average number of personal belief exemptions was 3%. However, in the county of Tuolumne, unfortunately, for kindergartners last year, it was 16% of students who had a personal belief exemption. In other words, they were not fully immunized.
Right. And so when we think about entrance into public schools, it's usually what we're talking about.
Right.
Does this law just apply to public schools?
No, this applies to public and private schools.
Private school. So, and we have a number of private schools in our county, and none of them are exempt from this law.
Correct.
Correct. Okay.
You know, one little interesting fact is when the state gets the numbers of percentage of immunized students, they are actually using kindergartners data for that statistics, for that information.
Right. I find it curious that the law applies to entering kindergarten and entering 7th grade. I'm not sure if we've analyzed why they've only chosen those 2 grades, because it seems as though if the law is the law, it means every child entering every year. So if
it's a starting point.
It's a starting point. That's a good point. So I was wondering if there's always a population that is approaching 7th grade that may not be immunized, but by the time they get to 7th grade, this law requires that they get their immunizations. What if I'm not, if I haven't immunized? Okay, go ahead.
I just wanted to
Yeah.
mention one
Okay.
other detail to that. Typically, if you follow the routine vaccination schedule, most of your childhood vaccines are done at about 4 years old. That would finish a series at 4 years old. And then the next time you need a series of few vaccines is about 11 years old.
Okay.
So that matches up to children entering kindergarten are usually around 5, and children entering 7th grade are usually around 11.
Right, that would make sense. Very good. What are the risks from a public health perspective for communities with high percentages of non-immunized students? I mean, we look at this law and we would assume the potential benefits as laws should be for the public. Without this law, what would have been the risk? What are the risks that we're running without immunizing our students? I don't know if each of you want to chime in, but Martha, you want to start?
Well, the risks are to have a community with diseases again, and from the public health perspective, immunizing students are actually the #1 tool that can be used to prevent that. So we want to prevent diseases and deaths. I understand up to 3 million people a year in the country can have their deaths prevented if we really all are immunized. So it's a protection. You know, we talk about protecting ourselves. We now have laws to protect people from driving into the intersections with signals, and that's to protect everyone, right? The same thing with, now we have laws for people that drive motorcycles. They have to wear helmets. That's a protection for the person, but also the community. So immunizations run, to me, in my mind, run the same way. We need to protect students that cannot be immunized, and We need to protect ourselves and our communities and our homes.
Well, it seems as though a generation has gone by, right? A generation or two, who may have forgotten, right, what it meant to be subject to the risk of getting these diseases. I mean, I don't know if you wanted to comment on what maybe this generation may not understand in terms of the risks that existed perhaps 100 years ago.
Well, I know from my personal experience, my father's sister was in an iron lung for 8 months because she contracted polio in the 50s, and he had a cousin who contracted the measles, and the fever rose so high, damaged his brain, and he ended up institutionalized. And I think because we did such a good job of immunizing students and the general population that we've forgotten how deadly, really truly deadly and harmful these diseases can be.
That's absolutely true. I've treated patients who have suffered from, the crippling effects of polio, and I've been trained, after the initiation of several vaccines in children that essentially have eliminated some of the major causes of illness, hospitalization and death in children. And my generation of doctors just doesn't even consider some of those bacteria or viruses as common sources of ear infections, pneumonia, meningitis, because so many kids have been immunized that we've been able to virtually eliminate them. We have actually been able to eliminate the disease of smallpox through vaccination. And if you go to other parts of the world where vaccination is not as common and people suffer from these diseases and see their children die from these diseases, they are eagerly asking for more access to vaccination because it saves lives.
Wow.
The other thing I would mention, and I apologize, is that, from the public health perspective, responding to an outbreak, if you're responding to an outbreak at a school with a 50% unvaccinated group of children, it is a much bigger problem than 92%. Measles in a school with 92% or 95 or 100% vaccination is not going to spread like wildfire, but it does in a school that is not vaccinated.
Right. Thank you for that important data. So you imagine parents who might be, or community members listening into today's show and approaching the deadline of really August of 2016, where they would have, if they have not been immunized, or their children have not been immunized, they need to do so before August. What would be, remind us, what's the timeline to get the immunizations done in time for school entry? How will that work? No, Martha?
Well, let's start with kindergartners, or when I say kindergartners, I'm also talking about transitional kindergarten, because those students have to be up to date before they start in August.
4-year-olds.
But they're usually, 4 years old. So there is a series that is already hopefully started with the child. In fact, most often they get their first hepatitis vaccination in the hospital when they're born. But most of them should have the vaccinations schedule completed by the 4th year, between 4 and 5 years. So those are the students that should be up to date at this point.
And for a child who's never never received anything, and will, in order to enroll in public or seat-based programs, they have to be immunized. What's the?
They need to start now.
Yeah,
start now. There are.
That's what I was getting at. I thought so.
We send letters out to the school that the students should be getting, the ones that need to be brought up to date and that we know of. They should start now. That's why we're encouraging them, because it may take, if you have never had hepatitis, it might take 4 to 6 months to be fully immunized. So that's where we want to start.
And the CDC does publish what we call a catch-up schedule for.
So when you say CDC,
Centers for Disease Control and Prevention.
Thank you.
It does publish a catch-up schedule for children who may be a little bit off schedule or delayed. So sometimes you can accelerate the schedule a bit, but even that requires usually a couple of months. So start early.
Right. And I know from a public school perspective and private school, they cannot even start school. They can't just say, oh, I'll go to the doctor tomorrow. They will not be admitted to school without proof of immunization.
Correct.
Is that correct? Okay,
Correct.
just making sure.
And Margie, that
Yeah.
would be in school policy also.
Well, I was going to ask a little bit about that. So how talk about that, Juliana.
So every school board has policies,
Right.
and every school district has policies, and especially policies that deal with something that's in law, and they generally have this policy on it, and this policy is available to parents. Either a lot of times the school district or a county board office will have those policies online, and you can just right off their website, or you can call and ask what their policy is. And that policy helps govern the way a school is run. And so that's the district's policy on immunization or on anything.
Any governance.
Any kind of governance.
Right.
And also represents the school's philosophy or the board's philosophy on any particular issue.
Right. So I know that there was a referendum that was did not pass to repeal this law, and this carries on. I mean, this is the new law. What are the positive outcomes that you think? Let me go to each of you. That result. What are the positive outcomes that come as a result of this new law, Dr. Ortiz?
Well, currently, if you're basing our numbers on the kindergartners from last year and assuming there was accurate reporting, we have the third highest rate of personal belief exemptions as a county in the state. So bringing that number down closer to the state average will really help protect our community in general, because children who are exposed to diseases at school can pass it on to their baby brothers and sisters, their grandparents, so it protects the whole community, vulnerable populations, as well as other children who have a right to be safe in their educational experience, who may not otherwise be able to be vaccinated.
Right. Martha, how about you?
But the other point is that students that are unimmunized and are maybe exposed to disease would have to be removed from school if there is an outbreak. And students are at school to learn, and so we want to prevent that as well.
Right. Right. And, you know, I know sometimes we think, oh, an outbreak will never happen here. You know, but we've learned through a variety of cases that we just don't know. And this is an opportunity to protect. Juliana, what are your thoughts around the positive outcomes?
Just that people are more aware. You know, like I said before, when something hasn't been around for a long time, when these diseases almost seem to be eradicated, we tend to forget how deadly they really are. A couple of months ago, I was doing something on the internet and came across a picture of someone with smallpox. And smallpox is almost unheard of now, but it truly was deadly and tremendously disfiguring to people who contracted the disease. And it's just that awareness that, you know, we have to, as a community, watch out for each other. And if we can protect, if our children are able to be immunized so that we can help protect children who can't be immunized, I think that's very important.
Right, wow. And thinking of the, what I like to call the first responders at a school campus for the protection of the health of a child, do we have nurses that can address the first responding needs of students?
Well, actually, in our county, we do not have nurses at each campus. We do have one nurse that works part-time at one of our bigger schools, which is very helpful, and she does address a lot of health issues that are now in the other schools left to their secretaries. And it is a concern to me as a nurse and as a provider of care for students with chronic health issues,
right,
that there should be someone, and it really, the responsibility falls on the secretaries, and I'm not sure that should be their job.
Right, and I know that they're doing a great job, but not aligned with their training or their ability to detect those. Wow, that seems like a real loss in our schools, not to have, because I remember growing up, I had a nurse that,
I had a nurse.
And when I didn't feel good, or who had to give me my vision or hearing test or check for my immunizations, it's hard to believe we don't have that in our schools today.
I think that's a lot of pressure to put on office staff also, because they have a whole nother job that they're doing in the office also.
Well, I know the collaboration with the Public Health Office has been remarkable. and the support that we get in our schools, but really that first responder, that person, man or woman, who can provide that, maybe the tides will change.
I
It
hope
would be
so.
nice
I hope
to
so,
see that.
because the chronic diseases are not going away. And if we see more of them, actually, a lot more anaphylaxis to all kinds of things, from peanuts to medications to...
Allergies and all those things.
That's right.
And an unhealthy child can't learn.
That's right.
That's true.
My last question is, how do parents access information about this? Or if they're listening to this program and they have a whole lot more questions, especially if they've been on the side of really not wanting to immunize their children, where can they get more information about this law? Dr. Ortiz?
One of the sources is the California Department of Public Health's website. There's a variety of information there. I believe some of our other guests have some other options as well.
Yeah, so actually the county schools office here has a fantastic website. If someone wants to go and look at www.tcsos.us.
Correct,
You can go down to departments and services, and you'll scroll down to health services, and then you just punch that one in, and you'll actually come up to my department, and we have a whole section on immunizations. We have what's needed. There's actually a timeline frame there. There's frequently asked questions, and it's very, very helpful.
Excellent.
And there's also a link to www.shotsforschool.org, which is another very good website.
Okay, so I heard it's TCSOS, and I think that stands for Tuolumne County Superintendent of Schools, tcsos.us, and shotsforschool.org.
Right, one word, shotsforschools.org.
Excellent. Great.
And then also, again, these letters are going out to the students that will need to have their 7th grade updates. I've asked, again, more responsibility for the secretaries. I've asked them to write down which vaccinations the students need to catch up, so that helps with the parents. And then I also said that there's my phone number's on that letter, but anyone that wants to give me a call, I'd be happy to answer questions. And I'm here at the county schools office, and my number is 536-2071.
536-2071. Excellent. And I do encourage our listeners, if you have questions, to call these experts, because it's best to get your questions answered early.
Right.
Before the deadline.
Right.
Juliana, what are your thoughts on how to provide parents with information?
Well, through school board policy also. If you are wondering what your policy is, your school's policy is, look on their website or call them and ask them, and you can actually get a written copy of what their particular policy is. Because often the policy is consistent of the law, of what the law says, and so what the schools have to follow according to the law. Then also they may have some other options. They can opt to add other layers to that policy also. So it's good to find out what your particular school's policy is.
Excellent. Well, we've learned a lot about what it means to immunize students for school, and that means both public and private seat-based programs with lots of information about how to access information about the immunization law. And thank you for listening and tuning in to this segment of Open Book. It's brought to you with our collaboration in Partners in Education, Black Oak Casino Resort. And I hope you'll tune in next time to a next segment of Open Book. Thank you.